Anxiety disorders are more than just feeling worried or stressed. They're a group of mental health conditions that can significantly impact a person's daily life. Imagine feeling so anxious about going to work that you call in sick, or being so worried about social situations that you avoid seeing friends altogether. These are real experiences for people with anxiety disorders. While it's normal to feel anxious sometimes, like before a big presentation or when facing a significant life change, anxiety disorders are different. They don't just go away when the stressful situation passes. With proper diagnosis and treatment, many people with anxiety disorders can lead full, productive lives. Anxiety disorders can manifest in various ways, but there are some common symptoms that many people experience. One of the most prevalent is excessive worry. This isn't just occasional concern about life's challenges. It's a constant, nagging worry that's hard to control and often focuses on everyday situations. Another common symptom is restlessness or feeling on edge. People with anxiety disorders often describe feeling keyed up or unable to relax. Sleep disturbances are also frequently reported by those with anxiety disorders. This can include difficulty falling asleep, staying asleep, or waking up feeling unrefreshed. Irritability is another symptom that's often overlooked but can significantly impact daily life. Anxiety isn't just a mental experience. It can have very real physical manifestations. One of the most common physical symptoms is muscle tension. People with anxiety disorders often report feeling tightness in their shoulders, neck, or jaw. Another physical symptom that many people with anxiety disorders experience is an increased heart rate. The heart may race or pound even when the person is at rest. Digestive issues are also common in people with anxiety disorders. This can manifest as stomach aches, nausea, diarrhea, or constipation. Sweating is another physical manifestation of anxiety that can be particularly embarrassing for those who experience it. Excessive sweating, especially of the palms or underarms, can occur even in cool environments. Generalized anxiety disorder, or GAD, is one of the most common types of anxiety disorders. People with GAD experience persistent and excessive worry about various aspects of their lives. This worry isn't focused on one specific thing, but rather spreads across multiple areas: work, school, health, finances, and relationships. The worry associated with GAD is often disproportionate to the actual situation. One of the hallmarks of GAD is that the anxiety and worry occur more days than not for at least 6 months. Physical symptoms often accompany the psychological distress of GAD. These can include restlessness, fatigue, difficulty concentrating, irritability, muscle tension, and sleep disturbances. Section 5. Social anxiety disorder and specific phobias. Social anxiety disorder, also known as social phobia, is characterized by intense fear or anxiety in social situations. People with this disorder have an overwhelming fear of being judged, negatively evaluated, or rejected in social or performance situations. This fear can be so intense that it leads to avoidance of social interactions altogether. Specific phobias, on the other hand, are intense, irrational fears of specific objects or situations. Common phobias include fear of heights, acrophobia, fear of spiders, arachnophobia, or fear of flying, aerophobia. The key feature of specific phobias is the intense desire to avoid the feared object or situation. This avoidance can significantly impact a person's life. Section 6. Panic disorder and agoraphobia. Panic disorder is characterized by recurrent, unexpected panic attacks. A panic attack is a sudden surge of intense fear or discomfort that reaches a peak within minutes. One of the defining features of panic disorder is the fear of having another panic attack. This fear of fear can lead to significant changes in behavior as the person tries to avoid situations where they've had panic attacks in the past. Agoraphobia often develops as a complication of panic disorder, although it can occur on its own. Agoraphobia is an intense fear of being in places where escape might be difficult or help might not be available if something goes wrong. Section 7. Coping strategies, mindfulness and relaxation techniques. When it comes to managing anxiety disorders, mindfulness and relaxation techniques can be powerful tools. Mindfulness involves focusing on the present moment, acknowledging and accepting your thoughts and feelings without judgment. One simple mindfulness exercise is the 5-4-3-2-1 technique. In this exercise, you focus on your senses, identifying 5 things you can see, 4 things you can touch, 3 things you can hear, 2 things you can smell, and 1 thing you can taste. Relaxation techniques are another valuable tool for managing anxiety. Deep breathing exercises, for example, can help calm the body's stress response. A simple technique is box breathing. Inhale for a count of 4, hold for 4, exhale for 4, hold for 4, and repeat. Progressive muscle relaxation is another effective relaxation technique. Section 8. Cognitive Behavioral Therapy, or CBT, and lifestyle changes. CBT is one of the most effective treatments for anxiety disorders. It's based on the idea that thoughts, feelings, and behaviors are interconnected. Changing thought patterns can change how we feel and behave. Therapists help identify and challenge negative thinking patterns. Lifestyle changes also play a significant role in managing anxiety. Regular exercise has powerful anxiety-reducing effects. Diet and sleep are crucial in managing anxiety. Quality sleep is vital, as lack of sleep can increase anxiety. Section 9. Conclusion. The importance of seeking help and maintaining mental health. Living with an anxiety disorder can be challenging, but help is available. Seeking professional help is a sign of strength. Mental health professionals can diagnose and treat anxiety disorders. They provide tailored treatment plans, including therapy and medication. Just as you see a doctor for physical ailments, seek help for mental health. Recovery from anxiety is a journey, not a destination. Maintaining good mental health is ongoing, even after symptoms improve. Support groups provide community and shared understanding. By seeking help and using coping strategies, you can manage anxiety and live fully.